Welcome to the Chairman's Perspective podcast.
Welcome to the Chairman's Perspective. I'm your host, Mark Billingsley, Chairman of the Shelby County Board of Commissioners, and my hope is that the Chairman's Perspective gives you good information about the work of our Shelby County government and our commitment to you on a daily basis. And with that, on today's show, we have Dr. Alisa Haushalter, Division Director of the Shelby County Health Department, and Dr. Bruce Randolph, Shelby County Public Health Officer. You certainly don't want to miss any parts of this show. We'll be right back on the Chairman's Perspective, powered by the KUDZUKIAN Network.
Inside 901.
Inside 901. I am your host, Lieutenant Anthony Buckner. Here on Inside 901, we will unpack the vision of Shelby County Sheriff Floyd Bonner and the various divisions of the Shelby County Sheriff's Office.
We have a racial profiling policy at the Sheriff's Office. We adhere to it. We expect our officers to adhere to it.
Uniform patrol that provide police services to unincorporated Shelby County.
Inside 901.
KUDZUKIAN! The Chairman's Perspective on the KUDZUKIAN Network.
Welcome, Dr. Haushalter, and welcome, Dr. Randolph, to the Chairman's Perspective. I'm really pleased you're here. Thank you so much, Dr. Haushalter, for being here. Can you tell the listeners a little bit about your background and being the Director of the Shelby County Health Department?
Sure. And first, thanks for having me here.
Oh, thank you for being here.
I'm a nurse by training. I'm originally from Pittsburgh, Pennsylvania. I spent about 30-something years, about 32 years in Nashville before coming to Memphis. I did my doctorate here at UT, so I actually feel like I know Memphis very well because I came back and forth from Nashville to finish my doctorate at the nursing school here.
Very good. And Dr. Randolph, you're new to the area. We're glad you're here. Tell us a little bit about your background.
Well, I am a physician, and actually I've been in Memphis since 1996.
Okay.
Came here as an occupational medicine physician.
Okay.
Prior to that, I was in public health in Oklahoma and subsequently changed specialties to occupational medicine.
Wow. And
moved here in 1996 from Oklahoma and been in and out of the city on various jobs. My background is from Florida, small town, Live Oak, Florida, and I attended Tuskegee University, Tuskegee Institute at the time.
Congratulations.
And I played football and went on to University of Florida for medical school and subsequently into public health.
Well, I work at a university, and it seems like we have more and more young people interested in the healthcare role, being a nurse or a physician assistant, a nurse practitioner. How do you end up in, Dr. Haushalter, you talked about starting out in nursing. How do you end up in public health?
So it's a really great question because we're always trying to recruit nurses into public health nursing.
Okay.
We are really a dying breed, so any nurses out there or nursing students, please think about it. Generally, nurses should have about a year's experience in the traditional healthcare system before they come into public health, but that's not always the case. I actually went into public health very early out of school because there was a nursing shortage, and I knew I wanted to be in public health, so I was able to enter the profession very early and have a lot of support and mentoring from others.
And you've enjoyed your career thus far?
I love my career. I tell people after almost 40 years, I love it as much today as the first day that I started. There's never a day that's the same. There's a lot of diversity. I'm very passionate about what I do, and I enjoy what I do every day.
Wow. Dr. Randolph, when did the physician bug bite you?
Well, actually, in terms of being a physician, that was a childhood dream, really, as early as age 6. But it really wasn't until I was at Tuskegee that I realized that I could turn that dream into a reality. And so after realizing I wasn't going to make it to the NFL, I decided to focus more on academics. And so I went into medicine in medical school. But it was in medical school where I decided that I wanted to be a health officer.
Gotcha.
So I'm finally fulfilling a dream that I had 30-some years ago.
Well, I know over the last couple of weeks we've been talking about the 200th anniversary of Shelby County. We've talked about all the amazing things that have happened in Shelby County over the last 200 years, but we also have a lot of challenges. In your role, Dr. Haushalter, in the health department, what are the biggest challenges we face in Shelby County?
I think we face some of the same challenges that any other big community might face. So those are things like obesity, overweight, chronic illness. That's a given. But some things that are very specific here, we're actually celebrating World AIDS Day. We still have transmission of HIV, particularly amongst the 25 to 34-year-old age group. Wow. So something we need to focus on heavily. We still have an infant mortality rate that's higher than other communities that we need to focus on. And then our opioid epidemic, we've been ahead of the curve on the opioid epidemic, but we still need to focus there. And then more importantly, and this is something Dr. Randolph and I are both very passionate about, is we need to do something about our homicide rate and really, as a health department, step up and do what we can do to reduce violence in our community.
Wow. You're listening to the Chairman's Perspective, powered by the KUDZUKIAN Network. Dr. Randolph, anything on that in regard to the challenges here versus maybe your background in Florida? Are they similar?
Similar, especially in terms of the major cities. The issue that I think is confronting us greatly that's not addressed is the violence. Yeah. Because violence really is a manifestation of a lot of other factors that contributes to the outcome of injury and death, and homicide, suicide. And that has always been my focus, is trying to address those underlying causes that lead to violence.
When do we start educating young people about public health? Is it ever too early? When do you suggest that you really start educating younger people about some of the challenges we face?
It's really never too early. I think we've got to talk about health as much as we talk about education and economics. Healthy people tend to achieve their educational goals, right, and educated people tend to achieve their professional goals. So we need to actually talk about that like we do other things, and it's never too soon.
You know, I don't know if we'll have enough in this segment to talk about it, but mental health in Shelby County, how are we doing compared to the national trends?
So that's interesting because there's not a lot of data collected on mental health. There are some national surveys that look at quality of life, but we have limited data available. But we do know that particularly depression is an issue across the country, and that's the same here in Shelby County.
Dr. Randolph, do you think physicians are afraid to ask that question about your mental health? You know, we go in, we get our physical, we get the x-ray, we get everything else done. You know, historically, to my knowledge, after working for a healthcare hospital here for many years, there was a trend where physicians didn't ask about your mental health. Do you think that's changing?
I think so, because physicians are realizing the importance of total well-being. Not only just physical, but mental, emotional, and even spiritual. And so physicians who are, should I say, aware, are more conscientious, will ask about a person's feelings, right, emotions, and their well-being. I think stress is a factor that is grossly underestimated and not fully addressed.
It's a great segue. We're going to be right back with Dr. Haushalter and Dr. Randolph on the Chairman's Perspective. We'll be right back.
The Chairman's Perspective on the KUDZUKIAN Network.
Hey, I'm Williams Brack, co-host of Grind Set. The insight you gain from us and our guests will motivate you to take the leap into entrepreneurship. Make sure to check us out on Spotify, Apple Podcasts, TuneIn, Stitcher, or your favorite podcast provider.
Grind Set on the KUDZUKIAN Network.
KUDZUKIAN!
I'm Mark Billingsley, host of the Chairman's Perspective and current chairman of your Shelby County Board of Commissioners. And in the studio today, I'm very honored to have Dr. Alisa Haushalter, Division Director of the Shelby County Health Department, as well as Dr. Bruce Randolph, Public Health Officer for Shelby County, Tennessee. At the break, we were talking about mental health. Dr. Randolph, you said you believe physicians are asking more questions. We're in the holidays. Some people refer to the holiday blues or crisis at this time. what can we do to either help ourselves during the holidays, or when we see someone who appears to be struggling with a mental health issue? What resources do we have in Shelby County, or what words of advice would you give?
So first things you can do for yourself is really basic care. Those are things that we take for granted, but getting sufficient sleep is important. Eating healthy and not overdoing alcohol, because that's actually a depressant. And keeping that in mind as we go into the holiday season. And then for people, Dr. Randolph really mentioned the importance of spirituality, for people to stay connected to their church and the things that they would routinely do so that they can handle the stress of the holidays in the best way that they possibly can. For those that we see that have problems, one, we have to be willing to ask the question.
Right.
And being able to support people to access resources, whether it's through their primary care provider or if someone's in crisis, they can reach out to the crisis line or actually have someone go to the emergency room if necessary.
Dr. Randolph, mental health, what do you think?
I think that one is remember, don't sweat the small things.
Right.
We tend to place, I think, too much emphasis on things that when you sit back, does it really matter?
Right.
And I think holidays should be a time when we should really count our blessings and really focus on the fact that, we're alive with our families, they're all healthy, and, making it to Black Friday is not as important as some may feel. I think the other thing is moderation. A little bit of sweet potato pie is fine.
Right.
Just don't eat the whole pie.
Right.
As well as diversity. You a little of this, a little of that. The thing is, I recommend to my patients in general is the formula is to pretty much eat less, move more, and manage stress.
Boy, really good words of advice. I have, again, worked in healthcare for a long time, but now working at a university, and I've exposed, even as a county commissioner, to so many young people. And it seems like we're seeing more and more young people with anxiety issues, depression issues. If you're a parent and you feel like your child is struggling with that, is it okay, Dr. Haushalter, to ask them that question? I know a lot of parents feel uncomfortable asking their child about mental health and depression because it's not something, the way I was raised, that you necessarily thought about. But what do you think today? Is that changed, and should parents, what's the right way to approach your son or daughter about if they're struggling with mental health issues?
We talked earlier about when should you start talking about health or the public's health, and I think it really does begin in childhood when you talk about mood and help children begin to understand what mood is and having that relationship with them as a parent or caregiver so that you can ask them throughout their young years and their teen years and comfortably ask them about their mental health, how they're feeling, what mood are they feeling. And then one of the things that we really try to stress is the importance of each child having a primary care provider.
Excellent.
So that if the parent is not able to ask the question when they go in for their regular annual exams, the primary care provider should actually be doing depression screenings with young people and asking those questions. And then also we have schools that can pick up if a child is having a problem. So it takes all of us to be able to assure that children have an opportunity to reach their fullest potential. And the parents play a role, but so does the primary care provider, so does the church, and so does the schools.
Boy, some great tips today from Dr. Haushalter and Dr. Randolph today from the health department, and you're on the chairman's perspective on the KUDZUKIAN network. Dr. Randolph, you lead the PHEPP program. That's a lot of letters there. The Public Health Emergency Preparedness Program. Tell me what that is.
Well, that is actually a branch, a program within the health department that's designed to help the health department respond to emergencies. And so our focus is to help build capacity so that in the event of a natural disaster, an outbreak, a terrorist act, that the health department can be mobilized to respond to any type of public health issue that may arise.
Can I add an example of that?
Please, Dr. Haushalter.
Because I know people have kept up with measles in the news.
Right.
So we actually had some measles cases here about 2 years ago. And so we activated the FEP team. We actually had about 80 people that we activated. And so we were able to reduce the spread of measles to only 7 cases in our county, where if you follow what's happening nationwide, they have thousands of cases. So that's a real live example locally of how the emergency preparedness team responds to local, what we call incidents.
Right. You see these on different movies now and TV shows about those ways to attack people through now, unfortunately, with different vectors and different things. Is that really reality, or is that on just the movies and TV shows?
So we prepare for that, but we've not had any of those incidences locally, but we are always prepared for that.
Right. Well, Dr. Randolph, a lot of responsibility managing our public health emergency preparedness program. Dr. Haushalter, in regard to our community centers, where are those located across the county?
We have 7 total clinics throughout the community, and generally what I ask people to do is go to Shelby TN Health, and they can see on our website which is the closest clinic to them. We have our main clinic, which is at 814 Jefferson, but we also have a clinic off of Sycamore View. We have a clinic at Southland Mall. We have a clinic at Hickory Hills. So we have those spread throughout. We have one in Millington, one in Collierville. So I encourage people to get online, and if they need to visit one of our clinics, they can choose the one that's closest to them.
And let me just ask you this question. Are the services at the health department free, or are they moderately priced?
It's going to vary significantly. So there are some services that are always free, like tuberculosis services, and then there are others that if an individual has insurance, their insurance may cover it, or it may be on a sliding scale. Particularly with immunizations, we want children to get immunized, so we work with the family to assure that the children are immunized at either no or very reasonable cost.
Very good. Well, hold on 1 minute. We're going to take a quick break, and we'll be right back with more of the Chairman's Perspective here on the KUDZUKIAN Network.
The Chairman's Perspective on the KUDZUKIAN Network.
Jazz, America's own original musical art form. When did it start? Who were and are some of the major players? How do you distinguish what kind of jazz you're listening to? We talk about the great and lesser-known artists, songs and tunes, the instruments, and the social impact jazz has had on world culture since its beginning at the start of the 20th century.
Riffin' on jazz on the KUDZUKIAN Network.
We're back on the Chairman's Perspective, and today we're talking with Dr. Alisa Haushalter of the Shelby County Health Department and Dr. Bruce Randolph. What a great conversation we've had today. We've talked about lots of things from mental health and try to get over the holiday blues at times to our respective health department and where they're located. Dr. Haushalter, right now I haven't had my flu vaccine, but I need to get it. I'm going to get it. You're making eyes at me. So let me ask both of you, how vitally important is it for youngsters as well as seniors and people who might be at risk to be sure that their immunizations are up to date?
So anybody over 6 months should have the flu shot.
Okay.
And the reason why it's so important is that we need to have enough people immunized in our community so that those who can't get immunized, like babies under 6 months old, or those who have immune disorders, don't get the flu from others. The flu is circulating in our community right now, so it's time to get the vaccine if you haven't already gotten it. And then for other vaccines, the same principle applies. You have to have enough people vaccinated to protect the whole community, which is what we call herd immunity. And things that we see resurging recently are measles. That's a really great example, is that, we need to have everyone adequately immunized.
So Dr. Randolph, being a public health leader, the myths about not getting your shots, I know there's a lot of parents, these days that do not immunize their children. What is your recommendation again?
What I would encourage everyone to have their children immunized. The thing is that when we look at things that have contributed to the overall health of our society, especially in the United States, public health measures such as immunization against diseases has played a great role. And one of the reasons why we do not have as severe of a problem with measles and mumps and a lot of those childhood-related illnesses is because of immunization.
Right.
Unfortunately, I think that we've been so successful that some people have forgotten the devastating effects of some of these diseases that can be eliminated through immunization.
But they can come back. They
can come back if you're not immunized.
Well, we're going to encourage all of our listeners, including myself, to go get my flu shot, and I'll get one. I'll come down to the health department and get my flu shot. Director, just recently there's been reports of lead in some of our school water fountains. How is your team working with all the stakeholders to eliminate this threat to children?
So I want to kind of give a little bit of background.
Please.
Is that Tennessee passed a law last year that required all local school systems to test their water. So Shelby County is actually one of the first schools to follow through and do what the law required, which was to test their water. And in some of their sites, they had elevated lead levels. Those were primarily in water fountains and other things that are not used frequently. So the first step to protect the public is that all of those sites are no longer accessible by children. So Shelby County schools have taken all of those things offline so that they can't be accessed. And then we're working currently with the school system to offer lead testing in the schools. We'll likely begin that probably the week after Thanksgiving or the following week, because we know children will be out all of next week. And we'll be going to a total of about 35 schools, hopefully over a 6 to 8 week period. So we want to ensure that, one, people know that the risk is very minimal from our perspective, but we want to offer parents the opportunity to get tested, and then to remind people there are many other sources of lead in the community, and most of that lead comes from paint in really old homes that have paint that precedes 1978.
We are on the chairman's perspective with Dr. Alisa Haushalter from the Shelby County Health Department and Dr. Bruce Randolph, Public Health Officer for Shelby County. On that same topic, all the services to get your child tested for lead, they're free. I know recently the Shelby County Commission approved even additional dollars in the event the health department runs out of dollars. But can you just tell parents what they need to do if they're concerned?
So if a parent is concerned if their child goes to one of the schools that had a positive lead test, they can go to any one of our clinics. And again, that's at Shelby TN Health, and just drop in any day. They don't need an appointment, and we'll do lead testing for free. Or they can wait till we come out to their child's school, and we'll offer testing in the school at no cost. And we do really appreciate the support of the commission. One of the things we really stress in public health is it takes a whole community to assure that we all have an opportunity to be healthy, and we each have a role to play. And the county commission, obviously in allocating resources and in some cases setting policy, helps assure that we have a healthy community.
Well, it seems like ever since this was discovered, the health department has absolutely been a leader. You've been a leader. You've been a great communicator on TV, radio, with the commissioners, with parents. I want to thank you for all of your extra efforts to really listen to families. You've done that very, very well as your staff at the health department. Just real quickly, one of the biggest areas that you deal with is how you also handle food in Shelby County. We have lots of restaurants. That falls underneath the health department. I always wonder, with as many restaurants as we have, just real quickly, how do you get all those restaurants reviewed and scored? How does that happen?
So one is a risk assessment, so that some restaurants get more inspections than others.
Okay.
So we know that. So if a restaurant doesn't score well, they'll get more inspections throughout the year. But our teams are out every day. They're generally also out on weekends to assure that they get that number. I mean, it's a large volume. You're correct about that. And so they have a pretty tight, I'll call it a quota, to be able to do all of the inspections and then to go back if there's an issue in any way. But I encourage restaurant owners, and particularly new restaurant owners, to reach out to us, and they can also do that through our website, because we do training and education so that they're prepared when we come out to do an inspection, and that they can assure that their food establishment passes inspection.
You know, there's a ton of food trucks out there. They're super popular. They pop up in my neighborhood and everybody runs down to the next lobster thing or the cheese thing, whatever. Does the health department inspect those food trucks?
We inspect them as well. And what we typically do is they actually come to the health department on Jefferson.
Okay.
So people may come by our health department and see food trucks, but they're actually there to be inspected, not to sell food.
Wow. Well, Dr. Haushalter and Dr. Randolph, you have certainly provided a wealth of information today, and we look forward to the great work of both of you and your commitment on a daily basis to keep all of us safe. Thank you so much for your leadership, and we're going to be right back with some closing thoughts on the Chairman's Perspective.
The Chairman's Perspective on the KUDZUKIAN Network.
Inside 901.
Inside 901, I am your host, Lieutenant Anthony Buckner. Here on Inside 901, we will unpack the vision of Shelby County Sheriff Floyd Bonner and the various divisions of the Shelby County Sheriff's Office.
We have a racial profiling policy at the Sheriff's Office. We adhere to it. We expect our officers to adhere to it.
Uniform patrol that provide police services to unincorporated Shelby County.
Inside 901.
KUDZUKIAN!
Certainly today, we hope the information shared with you by Dr. Alisa Haushalter and Public Health Officer Dr. Bruce Randolph with the Shelby County Health Department was informative and timely. All the work they do in the Shelby County is important and certainly appreciated. Their staff manages to ensure our food is safe, mental health and maternal and child health care programs, among many others, are running efficiently and effectively for everyone in Shelby County. So I want to send a very special thank you to all the employees of the Shelby County Health Department. They are truly some of Shelby County's best. We've had a great show today, and we continue to encourage you to listen to the Chairman's Perspective and the Commission in Action 2.0 by downloading the KUDZUKIAN app or by visiting your favorite podcast provider. Well, till next time, I'm your chairman, and you've been listening to the Chairman's Perspective powered by the KUDZUKIAN Network. We'll see you next time.
The Chairman's Perspective Podcast. Executive producer Shelby County Commission's Chairman Mark Billingsley. Directed, produced, recorded, and distributed by KUDZUKIAN.